policy engagement to our institution means that it's a place or it's a tool to bring evidence to the policymakers and questions of policymakers to the researchers.
Policy engagement to AFIDEP is our bread and butter. And I say this because we're an institute whose main mandate is to make evidence matter and to work with policymakers who are mostly in government.
Well, I think it's terribly an important aspect of trying to get research to policy.
So policy engagement for us is an emerging field, and it really, at the heart of it, is engaging with the key stakeholders for formulation of policy nationally.
Policy engagement is very important for the program because it's a way for us to translate our research findings into policy and make these research findings relevant to the nation, but also to the region.
So policy engagement has become more and more important and also very relevant for OUCRU because for our work we implement research with good quality, with good result. But we need to make sure that the results are translated into actual impact and actions to improve the health of the people.
For us, having good policy engagement means that we're more likely to have a good impact on health in the long term. It's also really important for us to be able to make sure that our research priorities are aligned with the priorities of the country that we work in.
Policy engagement is a framework that could lead our research findings to the policymakers, and that makes help the health impact to the populations.
It's very, very critical that organizations that are promoting or doing research understand how policymakers work, the bottlenecks that policymakers face in their work, in accessing evidence and in using evidence, and also understanding that evidence is not the only input into policymaking. Politics is a very, very big ingredient. Policymakers take into consideration politics. There are religious factors. Sometimes they even take their hunch. So the aim is to promote the value of evidence or the role of evidence in decision making.
The value of policy engagement is above all, first of all, to improve the quality of decision making and policy making. At the same time, is the value of policy engagement is to create demand for evidence-based approach in decision making.
We do really need policymakers to actually be informed of the research that's happening out there, so that they can actually make the right decisions when it comes to deciding on how the money is used, deciding what policies to implement, what programs to stop. So we do need that engagement. So research, if it's done in universities and it sits there without actually getting into the hands of policymakers, is not going to be of any value to anybody.
The value is really trying to ensure that we're spending our resources. So the government has a certain amount of resources and they need to spend it right. They need to spend it in the right programs for the right reasons and to have a bigger impact.
So the value of policy engagement is really about making sure that research is translated into direct human health benefit.
For MORU, the policy engagement is the way that the research evidence or research finding could reach to the policy makers, and that make the health impact to the populations.
It's really important to us that we are engaged with our entire international community as well as our domestic community in Vietnam. So it's important for us to make sure that we are active members of the networks that we're members of, and also to make sure that we create an environment that we allow others to contribute to our work and to allow diverse voices to be heard.
So the strength and the weaknesses of the strength is we feel that we have created a very good platform of engagement in the sense of, first of all, we have got a think tank where the researchers and the policymakers meet quarterly. This is a strength. It has never happened. Where under this a think tank, we have departed from the paternalistic approach of the think tank, where intellectuals or academicians and researchers think for the government. We are saying no, we have to change the paradigm and start thinking together.
AFIDEP works with policymakers, and their approach is really making sure that policymakers are strengthened to understand the value of evidence and research, to make sure that researchers also have the capacity to communicate with policymakers. Challenges sometimes come in because with the policymakers, there is also politics involved. And politics is a necessary evil for policymaking. However, it can cause a messiness in the policymaking.
We've had for the longest time problems or challenges in trying to actually approach or the policymakers or have the right sort of platform to engage with them. So it has always been sort of individual approach where one research project or research scientist, after his results have been finished and he's got them, and he then approaches the ministry. This platform actually offers us that opportunity to really engage with the policymakers, know what they want, know how to package the results that we have, and also have an opportunity to hear what are the relevant questions or problems that they have that we can do more research on.
So the strengths of our policy engagement approach are the inclusive nature of it and the diversity of disciplines and types of organisation. This gives us a bigger reach and it gives us a bigger opportunity to bring different types of evidence to bear on the problems. The challenges we face are, as you can imagine, with a diverse and large network, then bringing those individuals and organisations together and making sure that we're working in a complementary fashion. There is a coordination challenge.
The biggest strength that we have is that we try to involve the relevant government or stakeholders in our research processes from an early stage. This is not a short process. Normally we are doing research for many years before it becomes translatable into policy. And that length of time can be difficult for some stakeholders to understand or to appreciate how meaningful that kind of research will be in the long run.
One of the strengths for OUCRU in policy engagement is that OUCRU has been working in Vietnam for quite a long time, and OUCRU has an established reputation in terms of creating a good evidence from research. There are many challenges on the other hand because we have several projects and we try to identifying the right person, the right stakeholder as acting as a key focal point, for example, in the coordination of the policy making process is very important, and if we didn't find the right person, the right stakeholders, then the whole process takes so much time.
There are two challenges that I think we've identified in terms of policy engagement at OUCRU. One is that we really want our policy engagement to be more systemic. So we have really good policy engagement on a project level and on a level where individual researchers are themselves very connected with policy stakeholders. But in terms of looking at our whole program of activities, it's not very systemic at the moment, and we're aiming to improve that.
I think strength for our unit is our knowledge and the expertise in research. And sometimes this finding or this evidence couldn't reach to the policymakers or people who are involved with the decisions. So that would come to the challenge that the establishing of the relationship between our research unit with the government or stakeholders should be established.
At the African Institute for Development Policy, the main sort of a strength we see in promoting policy engagement is that we actually tend to establish long-term relationships with policymakers. We actually, work with them not only when we want them to work on something, but even respond to their needs.
Networks are very important because it's where we share the best practices, but also is where we also look at we learn from each other how to strengthen already existing policy engagement.
What we've realized is that not one institution can do this alone. And different institutions have their own strengths in different parts of what I would call the evidence generation and usage.
For me personally, the network approach it's a hypothesis really as to that's the best way for us to engage more broadly. And I find it stimulating, me personally, I find it stimulating that we can be discussing a particular epidemiological study in one forum, but we can be discussing the economic imperatives or a vaccine type in another. So it's stimulating to get different perspectives.
It's, I think, in my view, a very rich learning environment where you can learn from other people, but also you can see the commonality of issues that you're having to deal with. And therefore you have a collective understanding of what it is that you need to do to influence policy irrespective of the region where you're working.
I think the network would help us to expand our knowledge and also building our capacity and also learning the experience from other countries within the network.
The critical importance of this meeting for us is that by bringing scientists to really focus on policy engagement, we'll have more champions across the continent.
This workshop it was being valuable to me because I've met new people. We have seen that it's not us working alone in the silo. The other people also thinking the same. Somebody is my saying, always I say to myself, 99% of questions which we have in Malawi has been answered by somebody somewhere else.
So I think for us, it's more of trying to also hear what other people in other places are doing and also have the opportunity to hear what other people externally from Malawi think about what we are doing. So get suggestions. We know that, we may not have the right answer. There may still be a lot of areas that maybe there are things we're not doing really well. And it's an opportunity for us to have that dialogue and learn.
So my take-home message is that, I can summarize it into two parts. First of all, for the Malawi Wellcome Trust Clinical Research Program, that we are committed to doing research that will impact health in Malawi and beyond. But the second take-home message is that these policy engagement networking meetings are critical if we are to develop effective approaches, for research groups or research organizations to influence policy wherever they're working, because you get to share ideas and you get to develop approaches that are effective not only in one setting but in different settings as well. So they should be encouraged going forward.